Hey there, folks. Steve Christensen here. I am the Executive Director of the National Ice Cream Retailers Association. Nice to have you on board. This is a webinar in relation to opening and operating post-COVID-19. So we appreciate you being here. Just wanted to make sure that everyone can hear me okay. If you could mention to me that you can see my screen, hear me okay. Hello to everyone, Vicky. Yes, thank you. Everyone's raising hands. Everyone can hear loud and clear. Fabulous. A great contingent of Nicra members here. Cami from Carpajani, nice to have you here. The Magic Fountain. Becky Jacobs locally here, St. Louis, Missouri. Nice to have you all here. It's challenging times, but we're going to get through this, and it sounds like everyone can hear me okay, so we shall continue to jump in. So in this presentation, I'll spend a little bit of time talking about some best practices for opening and operating in this post-COVID environment. Dr. Sam Alcaine, who is an assistant professor in dairy fermentations, Cornell University, will also be spending some time. Sam's probably got shares in Zoom right about now, the amount of calls and meetings that he's had, not only food safety in the food service generally, but specializing also in dairy. So it's great to have him here. Sue Cloder from Cloder's Ice Cream Barn. I need to change that on the slide. Sorry, Sue, I changed the other one. We appreciate her time. And then Frank and Laurie O'Brien from Daddy O'Brien's Irish Ice Cream Pub in Sugar Hill, Georgia, will be joining us as well. So we appreciate their participation. From a general information standpoint, everyone's phone should be muted. If you've got some crazy dogs, kids running around the background, if you could make sure your phone is muted. In the process of going through this information, if you'd like to ask a question, you can type it in the Q&A area and we'll see that and respond to it. Also, if you'd like to ask an audible or a verbal question, we can always unmute you and have you ask your question directly. We hope to go about 60 minutes or so, and we will make this recording available on the Nicra website, as we have done with all of our webinars in this post-COVID area. A little bit about the National Ice Cream Retailers Association. We have opened this webinar up to the ice cream industry in general. We were founded in 1933. Actually, this is our 87th year. And we have over 800 member businesses, mostly retailers, but we have wholesalers and suppliers as well that create our network. Last year, we had a 44% increase in our membership. It's a great time to be involved in the association, particularly when you have that network. And I really feel that that's been one of the strengths of the association in the last couple of months, 2 or 3 months, was the strength of that network. And look, there are a lot of benefits. So we'd have you have a look at that. Currently, we have a free 3-month membership option. We felt that in order to help our current members, we extended their membership by 3 months, their membership renewal date, and we've also offered a 3-month membership for the month of April only. So if you're interested in joining Nicra and you're not a member of Nicra, you can simply go to joinnicra.org and you'll get the information there that you need. Today's meeting, primarily what we're after and wanted to share some information on is some recommendations and best practices when it comes to opening and operating your ice cream, frozen dessert business during this time. We're at the beginning of the season. Many of our members are just opening, some have opened, some are still struggling to open. So we want to give you some best practices there. And also want to have the opportunity to draw from some of our members' experiences. Both Sue and Frank and Laurie have had some real success in connecting with their community and boosting sales as much as they can through their experiences. So we'll look forward to hearing from them, as well as some community outreach. As I mentioned, these 2 topics, outreach and pint and pickup menu, is very, very relevant right now. So I do want to turn the time over to Dr. Sam Alcaine. Dr. Alcaine, or Sam as we know him, primarily works for the Institute of Food Safety at Cornell University, but has been very influential in a group of people that we have had develop this safe ice cream hub. And the link for that here is safeicecream.org. Cornell have been very involved. The IDFA, the Center for Innovation Center for US Dairy, has also had a great collaboration, as well as Nicra. And there's some great training to be had here at this safeicecream.org. So I'm going to stop my share now and throw it over to you, Sam, if you can grab it.
Yeah, I think, can everyone see that?
Yes.
Great. Awesome. Thanks for the intro, Steve. And yeah, so what I was going to do with my time really is we've been holding, I see a chat here, make sure. Yep, looks good. So we've been holding, as Steve mentioned, we've been holding these COVID-19 office hours for the food industry. Some has been dairy focused, some has been just broadly food industry focused. And I just wanted to kind of bring in about 3 points of some of the areas that we've, repeatedly gotten questions on during these sessions, to just kind of inform everybody and kind of bring everyone up to speed on the knowledge. So one of the first areas, and not surprisingly, right, that we've gotten a lot of questions on has been around, right, COVID-19 transmission, right? And how does that happen? What should I be concerned about in my facilities? And so the first thing, right, when we're talking about COVID-19, right, the virus, the coronavirus, is that from the epidemiological research right now, the primary mode of transmission of the virus is through these large respiratory droplets, right, that we kind of comes out of our mouths when we sneeze, when we cough, sometimes when we're talking. And these are when we're talking about droplets, these are pretty large droplets. And so, right, they react to gravity, and so they'll drop in a pretty short distance, right? The rule of thumb that we're seeing from CDC and the guidances, right, is, around 6 feet. It's not like a magic wall that the droplet just suddenly drops at 6 feet, but it's a good rule of thumb, all right? And, that's the primary route. There's been, I know there have been some reports in the media and some papers where they talk about aerosolization, which it talks about like these finer droplets that may stay in the air longer. And one of the things, there's a lot of things we don't know about coronavirus, a lot of things that we're learning, right? And in these aerosolized discussions, when you look into those studies, what you find is a lot of times they're not looking at infectious virus particles. They're looking at for like the RNA, right, of the virus, which may last longer than the virus's ability to be infective, right? And so you have to kind of take some of those studies with a little bit of grain of salt. And when we really look at the epidemiology, what we've seen is that it is definitely driven mostly by these respiratory droplets, right? And so that's why there's a lot of focus around social distancing, all right? Now, there is also, right, the other major route of transmission that we've talked about is close contact with individuals who are sick, or also that may be asymptomatic, so they're not showing symptoms, but they have the virus and they're generating more viruses and they're able to spread. And so distance is important there, but also preventing contact with these people, or maybe surfaces that they've just immediately, right, encountered, especially if it's somebody who's very sick. Well, one of the things to think about there when we think about then controlling for surfaces, because I know, again, in the media and there's been scientific studies about, right, how long does COVID-19 survive on surfaces, right? There have been studies that have suggested, right, up to 72 hours on plastic, shorter on stainless steel and cardboard. And again, one of the things to think about that when we're concerned about our environment and touch points is to remember that those studies, right, are under ideal conditions, right, in a lab with a very high load of virus so that we can study it. And those don't necessarily always represent the real world conditions. So we wouldn't expect to see those same loads on surfaces. And the data shows that the virus does kind of, right, inactivate pretty rapidly. Its half-life, right, is only a couple of hours. And so that should provide us at least some confidence, right, that we shouldn't be overly concerned about the surfaces. Now, one of the good things to remember, though, when controlling on surfaces is that, right, this virus is, right, susceptible to our basic cleaning and sanitation practices. So coronavirus, this COVID-19 or SARS-CoV-2 virus, it's really, right, effective at infecting our cells, But one of the reasons it's able to do that is because the virus has this lipid envelope, okay, which is not common in other viruses, say like norovirus, which has just a protein coat. So this lipid kind of capsid, or this lipid envelope, is very susceptible to detergents and sanitizers. So it's easily to disrupt, and then that renders the virus inactive. And so the regular washing of our hands with soap, right, for at least 20 seconds is great. So if we've touched something that's contaminated, we wash our hands and it's good, right? We're with that soap and water. Also, the sanitizers that we use to clean our non-porous surfaces, so those stainless steel, plastic surfaces where plastics, if we're cleaning these, right, using our, our standard SOPs, we should be effectively removing this virus, right, and inactivating it. So we've got good control measures and ways, right, to control the transmission of COVID-19, right, through social distancing, hand washing, and also then making sure that if we're touching things that we're not also touching our face, right? And that kind of helps break those routes in transmission. And so there was a lot of talk in our office hours about that. The other area that we talk a lot about, and I think Steve is going to touch a little bit on this, on the best practices, is how do I protect my employees, right? And so one of the major critical thing, right, is if you have an employee who is sick, you're going to want to make sure that right, that they don't come in, right? You don't want to bring that into your facility. And so I know even if you're not sure that they have COVID-19, if they're showing symptoms, so like a fever over right 100.4 degrees, if they've got a cough, if they got difficulty breathing, recommend that they stay home. Encourage them, right? Tell them that it's going to be okay. Just stay home, keep them at home. We're seeing a lot of facilities and food service places looking into screening of their employees. So at the minimum, asking them if they're showing symptoms, or if they've experienced symptoms, or they've been in contact with someone who's had COVID-19. Also considering, right, taking their temperatures, right, with a non-contact thermometer. If you don't have those, maybe you could do some self-reporting if they have a thermometer at home, but just kind of making sure, right, that you are kind of putting this little barrier so that someone who is sick or potentially sick doesn't come in to the workspace and then get your other employees sick. Again, I mentioned earlier, social distancing is key. So I know some of us have small spaces and things like that, but rethinking about, the spacing of your employees, maybe that, it means that you can't serve as much ice cream as you want, but at least you can keep people, healthy, which means you can serve ice cream right at all. We also see some places looking at, installing different types of barriers, plexiglass barriers between, your employees and the public that stops in, or between workstations between employees. So that might be something to consider. Again, as I noted on the transmission, making sure that there's frequent hand washing with soap. If they can't do that, then making sure that you're using the appropriate hand sanitizer, right, with at least 60% alcohol in it, is effective at inactivating the virus. Again, following good hygienic practices, no touching the faces. One of the recommendations that kind of came, halfway through our office hours from CDC was initially we were talking about saving face masks, right, N95 respirators, and surgical masks for healthcare workers, and we still have a shortage there, so they should be saved, but they've also now talked about implementing cloth face coverings, especially for essential workers and people in public. And so if you have challenges in your facility where social distancing is difficult, it is, right, strongly encouraged then to use cloth face coverings. And the idea there is that these cloth face coverings, right, they can be made of different materials, and so their efficacy as far as preventing, you breathing in COVID-19 is not really well studied, and it's probably not that great. It might provide a little bit of protection, but it's really around catching if somebody is asymptomatic or pre-symptomatic but are shedding the virus, and they have those, they cough or they have those large droplets while they're speaking. That face covering will capture those, right? And so that they won't then make other people in the area sick. So your face covering is really about protecting others, not about protecting yourself. Other people's face coverings protect you, right? And so by building that kind of barrier, those kind of practices, you can kind of help minimize the risk of transmission within your facility. Again, cleaning and sanitization of our surfaces is critically important. Again, watching for high touch point surfaces, right? So doorknobs, cash registers, utensils, things like that, and figuring out then, can you minimize what is being touched? And if you can't, making sure that you have a pretty frequent cleaning and sanitization program around them. And then when we're talking about our employees, it's not just thinking about inside our shop, but thinking about outside. Just try to understand, what are their living situations like and things like that. How do they get to work? Are they taking public transportation? Are they carpooling together? These, higher density, situations, kind of increase the potential risk of transmission. So you may want to think about that. Also, where do they live? Do they live with a lot of people, or do they live individually? All these kind of things can kind of impact, and you should at least be cognizant of when thinking about how to protect your employees in your facility.
Sam, and you may see in the chat here, Jim asked about, if they've got a small location, how do they social distance between employees? But I guess you touched on a little bit there so far as if your employees are in a tight working space, at least if they're wearing mask, gloves, and if there's the ability to separate workspaces with a barrier, that certainly helps, right?
That certainly helps. Yes, exactly. Right. But remember, again, try to really challenge yourself to think about spacing, right? Because those cloth face coverings, they are not a replacement for, right, the social distancing and the hand washing and things like that, right? They're kind of providing that last little, mile of protection, but the foundation is those others. So really, if really think about that, right? But yes, when you look at what's going on with like the meat processing plants and things like that, again, where they have an issue with tight spaces and separation, they are turning to these cloth face coverings and barriers to kind of help them, provide a little bit more space.
Thank you. And let's talk a little bit about freezing temperatures. I mean, obviously, a lot of our products are stored, made below freezing temperature. Does freezing temperatures have an aspect or a?
Right. No. So unfortunately for freezing is going to actually help preserve the virus. So it's not a kill step. Really, the virus is sensitive to heat, right? And some moisture, right? So that at least that's what the studies are showing. So unfortunately, refrigeration and freezing is not a way to help us eliminate the virus from our facility or from our things like that. But again, what we've seen so far, right, is that food packaging is has not been a significant source of transmission. So we're pretty good there, as long as you're following these other practices. So
sure. And then Doug asks, cash sales.
Yeah.
I know a lot of retailers have really strived to say as part of their process, and you mentioned it earlier, Sam, which I think is well worth, is that this isn't a return to normal. It's a return to try and get some volume through. And even if you have to say, look, we're not doing cash, we're only doing card or online ordering, may be the way to go. Do you have you kind of seen much pushback on cash sales?
I haven't seen that much pushback on cash sales. What I would remind yourself, if you're doing cash sales, then whoever is responsible for that really needs to be cognizant, right, of not touching their face, right, when they're handling that cash, and then also, right, regularly washing their hands again between transactions, so that their hands are clean again. Or if you're wearing gloves, right, that those are being regularly changed in between, right, because right, gloves don't clean themselves. They can also, if they're contaminated, they can also act as a transmission vector, right? So again, making sure then whoever's handling the cash is regularly either washing their hands with soap and water or sanitizing their hands, knows not to touch their face, and things like that. Yeah, that's what I would recommend for cash. But of course, if you can use credit card or something that's non-touch, that's the best case scenario. But
unfortunately, all you need to do is say, don't touch your face. And it automatically makes you want to touch your face.
Yeah, it does make your face itch, doesn't it? Yeah.
Right. Any other questions for Sam? He'll be on the balance of the call, and we will have some Q&A at the end of the call. But happy to move on.
All right.
And again, I want to thank you, Sam, for your time. I know that your office has been extremely busy. Well, your office. You mentioned this morning that you missed your office on a call.
Yes, I do.
You-
I miss the quiet space that I get.
right. Nathan asked, a lot of places are out of wipes and sanitizer. Are there good sources to get them? We'll actually be talking about that a little bit later on in the webinar, but can you lead to that, Sam?
I personally don't have, I guess, the retail stores here have actually started carrying sanitizer again. So this may be a regional thing, but I know that there are a lot of companies out there that are pushing. So FDA had put out some guidances for even distilleries, right, to be making hand sanitizers, right, that contain the appropriate amount of alcohol and things like that to be effective. So I know that people are working on that, but if you have a little bit on actual context for that, I'll leave that for you.
And do you recommend that? I mean, there's a lot of recipes floating around online about making your own sanitizer with isotropic alcohol and so forth.
Yeah, I do not recommend making up your own home batch of sanitizer, right? There mistakes can be made and things like that, so it's better to purchase it. Okay,
Right.
would be my
Good advice.
Yeah.
Well, thank you, mate. Really appreciate that. Great information. So let me jump straight back onto my presentation here, and we'll continue on. And again, please feel free to ask questions as we go. One more point in the chat here before we jump on. No, it popped off. So next I wanted to talk a little bit about a pint program and some of the ways that some of our members have really been very nimble and pivoted in relation to how they've gone to business. So Sue Cloder has got a fabulous business in Ellington, Connecticut. Sue's on the Nicra board of directors and also heads up the scholarship committee, which we would recommend you looking at as a Nicra member. And so we might appreciate her time here. Sue has really done a good job in going through this process of, pivoting a little bit and offering a pint program, which has worked very well. So Sue, if I unmute you here, you should be able to chit chat.
Hello.
Hello.
You can hear me okay?
Yes, I can. Thanks for coming on, Sue.
Okay, very good. My kids tell me I talk loud, so I should be in good shape. So I'll give you a little background about our business. We're a seasonal walk-up window, as you can see from the photo, that we're in our 8th year of business here, and we serve hard and soft ice cream. We do milkshakes, sundaes, and floats. Pints are a menu item we have always avoided because we don't like to scoop them when we're busy. So we charged a lot of money for them and we didn't like to do them. So that has changed. We are a business. We employ about 25 team members during our busiest time of the year. So we're a busy shop. We're open 6 days a week, 12 to 9:30. And our main family business, just to kind of give you an idea, our main business is called Cloder Farms, which sells sheds, gazebos, and playscapes. We also have an indoor furniture store that sells made in America products. So we have a 16-acre display area, and our ice cream shop sits within that display park. So the ice cream shop was added in 2012. So in 2020, our plan was to open on April 14th. We're usually open mid-April to Columbus Day. So that was our plan. Of course, then COVID happened and we were well into our quarantine time at that point. But interestingly enough, there was another ice cream shop in our town that was looking to open on April 1st. And they received some pretty sour feedback from our community because they were doing that. So we kind of watched what happened there and we said we didn't want to be in that scenario. So we decided to make an announcement that we would postpone our opening. Connecticut currently has a shelter in place order until May 20th. So that's still quite a ways away. So considering we had already received a delivery of 230 gallons of ice cream, we decided as a family that we would scoop some of that ice cream into pints and pre-order those online. So thankfully, my husband and I, we have 4 children. 3 of them are pictured in that photo, but we have one other son that was not there at the time. But everybody's just kind of jumped in. We all live in the same house, so we weren't bringing in other team members and risking that infection scenario. So we pretty much handled it just as our family. So we decided to scoop into pints. We set up Square online, and that allows contactless payment. So what we did is we posted our online store opening on a Thursday morning, and the plan was that we would have those sales available for certain flavors. We did 10 flavors last week, and then we would have them available for pickup on Saturday night between 6 and 8 p.m. So as we went through the day on Thursday, sales were going crazy. And before I was ready to go to bed, I told my husband we had already sold 555 pints. And I said, I don't think I can go to sleep and just let this online store keep going. So we had a discussion and we decided to stop the pint sales because we literally had never done this before. It was a trial run and we didn't know that we could handle it. So we closed the online store, went to bed. I woke up, I think about 3 a.m. My mind was racing. I wrote a list of things I had to do to make this all happen. And then I went back to bed and slept fine. So anyway, we were charging $6.95 for our pints. The cost for us was $2.70 a pint. That included the product, the labor, the credit card fee, which I'll talk about, and the container that we put it in. So the credit card fee, we are paying the online stores a little bit more. So we were paying, I did the math, and we're paying 4%, which is much more than I would like to pay. But 2 things strike me on that. It's a convenience right now for us, and it's also a safety feature for us and our customers, that we can have that contactless payment. So in hindsight, we learned that we can create an inventory of our pints on Square online. I did learn a lot from Valerie Henrici from Yummies in Warsaw, New York. She answered a lot of my questions about Square online and told me you can create an inventory. So if you only have, say, 48 pints of chocolate, you can put that in the system so you don't oversell. Thankfully, we didn't oversell on any flavor, but that's a real good thing to keep in mind. So we currently do that. We put in our inventory, and then the Square online will tell the customer that looks at it next, it's sold out for that flavor. So we stored all of our pints in our deep freeze, which was -20 degrees. As we were scooping them throughout the week, we put them in the deep freeze, and then just before our sale at 6 p.m. on Saturday, just before our pickup time, 6 p.m. on Saturday, we brought them all downstairs into our dipping cabinet, which is the center picture you can see. We also had another small dipping cabinet to the side that was a movable one that had our overflow. Some flavors, our top 3 flavors, we actually sold over 100 pints of each one. So we had a little overflow in this smaller dipping cabinet that you can't see in the photo. I'll just quickly review how we handled pickup. So those 555 pints we sold, it was 182 orders. So what we did is our main business closed at 5. So at 6 o'clock, we started the pint pickup. We had it set up that when someone pulled into our parking area, we set up cones so that they had to flow a certain way, and they did a loop around. When they first entered the parking area, my son took their order number and last name. When you purchase using Square Online, you will receive an email that gives you an order number. And we utilize that order number to pull up the orders. So my son was on the phone, a continuous phone call with my other son who was at the register. He told him the order number. My son then pulled it up on the register. It went to the printer. He could hit print, and he could hit also that the order was picked up. So it kept track of what we still had to put out. So it printed, we grabbed the printed ticket, stapled it to a to-go bag, grabbed the pints that order needed and put it out the window, and my husband grabbed it, brought it to the car. So by the time that car had looped around, we had their order ready, and they were all in order, and each car just basically, it was like a drive-through. They just went right through and followed the cones to a different exit, and it went very, very smooth. We had excellent feedback. No cars that we know of waited more than a few minutes for pickup. So last week we did 10 flavors. This week we're doing 13 flavors. And probably next week we hope to do some sort of family pack that would include our own chocolate sauce and toppings and perhaps waffle chips. But that's to be discussed, I guess. So this certainly could work. It works for pints. It could work for quarts. Definitely something that's stackable is a nice feature because space is valuable. Those with domed lids, to-go cups with domed lids don't stack as well as a flat lid. So it's just something to keep in mind.
So a couple of quick questions
Yes.
on that have come in. What are the dimensions of your building?
Oh my. It's 22 by 24. It is actually one of our sheds that we created to be our ice cream shop. The upstairs is very deceiving. The back is a full dormer. In the upstairs, I'm actually sitting there right now. I have 4 chest freezers. I have 2 commercial refrigerators, and I've got plenty of storage space.
That's like the TARDIS. Yeah, it looks like from the outside. There's a lot going on in there.
Yes.
So Becky Mead asked, are you keeping normal hours right now? Have you adjusted or limited those hours?
Normally we're open 12 to 9:30. So we are only open for this. The pint sales are all online, and the pickup on Saturday night is the only time we're open for those pickups. There's no come up to the window at this point. Probably not till after May 20th when the shelter in place is lifted.
Okay.
Truthfully, we're probably doing a third of the sales dollar-wise that we would normally do in a week when we were open for regular season, but it's better than no sales.
And so Nathan asked, do you already have a good following on social media in order to spread the word about the pints, or did you spread it in another way?
We used our Facebook and our Instagram page, and we have pretty good following. So, yeah, it's not a problem for us.
Okay. And Penny asked about hand packing, that her customers want them fresh packed, but you don't make your ice cream currently, right? So you're actually getting those 3-gallon tubs in and packing them, hand packing them. Right?
Yes, unfortunately. Yeah, we have three suppliers that supply us with ice cream. Actually, all this ice cream that we scoop for pints comes out of Lancaster, Pennsylvania.
Okay. A question was asked about using Venmo for payment, and this has come up before. One of the terms and conditions for Venmo is that it's not used for commercial or business. So, but I know I've seen a lot of ice cream shops with their Venmo tag or handle on a chalkboard outside, and that's come up a couple of times. So I would be a little bit just wary of that. Laura says you can also set the register to auto print receipts as they come in. good information. Becky Jacobs here in St. Louis has a different pint system. We can certainly chit chat about that. What do you suggest for controlling crowds? We are open February 15th and closed 19th of March, mainly because we could not control the crowds. That's always a challenge.
Yeah, that's why we went to this process for the time being, because our shop is a huge community hub. We have a fireplace and a fire pit, and people love to hang out there. And we just can't have that right now.
Right. Kelly asked, does Square let you know when you have an order come in?
Yes. Yep.
And is it connected to your Facebook? I don't quite know what that means.
Is Square connected to the Facebook? It does an audio. I can hear like a bing when an order comes in if I'm in the shop. And it also does send me an email.
Jim asks, they do soft serve only and the opportunity to sell soft serve to go.
You know, one of our family's favorite things is soft serve that we put in containers and put in the freezer and bring it home later. And you scoop it, it's delicious. As long as you have quality soft serve, it's creamy and delicious. I don't currently do that, but I don't think it's a terrible idea. I don't know if anybody else wants to chime in on that.
I've got, let me just see who's raised a hand here. Becky, can I unmute you? Are you ready to roll? Let's allow Becky to talk. I'm trying to unmute you, Becky. I'm trying to unmute you, Becky, but I can't seem to do that. And she'll go mad at me later on for that.
How about now?
Yes.
There we go. Hi, everybody.
Hey, Becky.
So, Sue, you're doing something very similar to us, but I have the benefit that I make my own ice cream. So what we're doing, when I say we, I mean me solely, I work 3 days a week, Monday, Tuesday, Wednesday, making ice cream, pinting all of it. And then I sell Thursday through Sunday. My social media manager created a form on Google. So people order through that form, which sends me a message. I collect, and what time they're coming to pick it up. I collect their order, put it all together. So all me in the shop, all by myself. I'm doing all this on my own. I send them a PayPal request for money. When they pay me, that's their confirmation. And it's all curbside pickup. So we have a table out in front. They text me when they get here. I walk outside in glove and mask, put it on the table, and they come and pick it up. All touchless, no money. Although I do accept cash tips from them, since it is just me, I'm not too worried. And I use all of that tip money because I do have 1 or 2 kids who will come in. These are kids that have had keys in the past. So I let them come in when I'm not here, and they make my drumsticks for me. And so that's another item that we sell. But we are all pints, and then we also make pint kits. This might be something y'all might want to check out. I know a lot of people are doing them, but it's working because I'll sell a hot fudge kit. It's a pint of vanilla ice cream, hot fudge, nuts and cherries, no whipped cream. And I charge $16.91 for that, and that includes sales tax, and I charge the PayPal fee back to the customer. So it's all very neat and tidy, no touch at all. And our stay-at-home for St. Louis County, even though our state says it's going to be lifted May 4th, our county is at least until May 5th. I'm sorry, May 15th. Okay. So we're going to keep this up until then. And then what I'm thinking about doing, and that's part of what I'm trying to get from this webinar today to kind of get a feel for what other people are doing, is I will have one other person in the shop with me so that I can add a little bit of items to our menu. So we might want to add shakes or our ice cream sandwiches that we make fresh. I might do those. I'm not sure yet. But one person, I saw this on the Nicra, I think it was on the Nicra members website, and I would love to know who did this because I want to talk to them. Somebody has a baby monitor set up outside. And the customer walks up to it and places an order, totally touchless, and you can hear them inside because the receiving end is on the inside. Or they do it that way.
I did see that too.
That would be a great thing for me when I reopen. The only question I have that I still can't figure out is, how do you handle contactless, cashless payment with that?
Right. Well, we are going to talk about that in a minute, and we do need to roll on, but I really appreciate that, Becky. It's good to get that perspective from someone who makes their own. Thank you, Sue. We really appreciate that. I know it's, again, we're very sensitive to the fact that a lot of people can't trade, but for those who can, very, very good information. So thank you. Wanted to scroll down now and chat quickly to Frank and Laurie O'Brien. And Frank and Laurie O'Brien have got Daddy O'Brien's Irish Ice Cream Pub. They are in Georgia. And again, they've done a great job in outreach so far as really connecting with those in the community who want to donate ice cream to emergency services, and also those directly selling to and donating to emergency services. So, Frank, can you hear me? Can you chit chat?
Yes, we can. We can hear you fine.
How you doing?
Hey, Laurie.
Hey.
I'm sorry too. This is on this slide. This is Frank over here on the left-hand side. He said that he got his beard trimmed and got a haircut for this, and I told him that we weren't going video camera. So he's a bit, but there he is regardless. Thanks, Frank.
Hey.
Okay. So what had happened is we are a full-service ice cream pub and restaurant, and so we've been open. We're open year-round. And when all this hit, obviously it was like a ton of bricks. It cut our business, and in fact, it hit right before St. Patrick's Day, which is obviously our biggest day of the year. And we lost a tremendous amount of money. And when they shut us down, it came through our city manager, and our mayor came in to see us. And we have such a strong relationship with our city and our community that they came and told us what was happening before anything legally happened. So when the community heard what was going on, we have a very good friend who is our insurance agent, and he came in and he said, he had some background in the food industry and he knew the impact this was going to have. So he said, I want to help. And what we all the idea we came up with is he wanted to buy some ice cream and donate it to the first responders. And so we decided that, especially all the hospital workers definitely needed a break. And so we decided that let's contact our local hospital and see if we can arrange to bring some of the ice cream to them. So he went and he bought 100 small pints of ice cream, and we made contact with the hospital. And as you can see some of the pictures there of the hospital workers, we had a line for 2 hours. They said there was about 100, originally said about 150 workers. We ended up serving over 375 people that day. It was such a tremendous success. These people were just so grateful that actually somebody from the community would actually think of them and bring out some refreshments and just take a break. Just 10, 15-minute break from what they were doing was a tremendous uplift for these people. So this was such a great success. We continued on, and our insurance agent went and he bought some more. He's bought several hundred ice creams, and we've delivered them all over. We've gone into nursing homes. These poor people they've been locked in shelter in place for at least 6, 7, 8 weeks now. And what a treat it is for them. And it's just, it got the wind of our local TV station here, Fox News, and they did a story on us. And once that hit the air, more and more people came in, people from our local community, our city council people came in and said, we want to help too. We want to continue this on. So we have several outlets of people coming in saying, here, we've gathered up some money from our community, our neighborhood, and we want to give back. So they come in and they say, well, we'll find somebody. It will be a firehouse, it will be a nursing home, it'll be one of the hospitals in the area, and we'll contact them and we'll arrange and we give them a treat.
We brought treats to both of our grocery stores nearby. We have Publix and Kroger's, and people from the community paid for it. So not only are they helping others on the front line, but they're helping us who is in their community, and they love us and they don't want to see us going away. That's one of the comments we get all the time, is people coming in saying, please, please don't shut your doors. And we say, well, it's all up to you. It's up to the community to help us. And they come up with different ideas. Now, the newest idea that has been happening is subdivisions are calling us, I mean, several of them a day. And we are taking orders online for subdivisions for both food and ice cream. And then we take orders for 2 days. We take 1 day to get ready and prep. And then the day of their event, we bring out all of their food and all of their ice cream. And they come at, at specific times, and they pick up their ice cream and their food. Yeah, we set up a tent and we put in the cart, as you can see in the picture on the left. We bring the tent in the cart and Cambros with the hot food, and give out the ice cream. And right now we have about 11 subdivisions in the next 3 weeks that have booked us to come out.
Yeah, that's great. And I know that Frank and Laurie are also very active on social media as well. So, building up this infrastructure of contact over multiple platforms certainly pays off. And there's a really nice balance here. And the reason why I wanted to talk to Frank and Laurie on this webinar was it's a nice balance between them out and serving their community. And sometimes it's a delicate balance to kind of, I know some ice cream shops, particularly West Coast, even some that could open, were kind of encouraged not to open because of the perception of, getting people out and doing things. And I just think that this is such a great balance of helping those first responders and medical workers, but also supporting the community and marketing your business and having some process of sales at the same time. It's a great program.
Going through all of this has brought some good positive things out of it. It forced us to do online ordering, which we had not set up yet. And we started making ice cream pies, which we never made before, and we posting it on Facebook, and people are wanting them left and right. So it's really helped us in some ways. God works all things out for the good.
Well, thank you. I very much appreciate that. Thanks, Frank and Laurie, for your time. I'm going to jump back over here to the balance of our presentation, which for the most part is just going through some best practices. So again, if you have any questions as we go, please let us know. We've probably got another 10 or so minutes to go, and then we'll have some Q&A at the end. Now, so far as general practices, again, the Nicra office here monitors a lot of the different state, county, federal legislations, as well as what a lot of our members are doing. Our goal here is to kind of provide just a general overview. So obviously, first you'll want to check with your local authorities, and we're going to just touch on some of these points a little bit more in a minute. Check with your staff and parents so far as notice for work, clean and lay out the store, the public perception of glove and mask policies, your social media and website review, and some modifications to your website. So initially, obviously, your local and state authorities are going to be the best source of information from you. And we've heard, even on this call, that there have been different restrictions and different openings, even on the two calls that we've had here. Most of the time, that's the health department. Sometimes that might be the building department as well. If you're in a city that has a smaller county or city office, they may be the same. I also would check with your labor laws. We've got a lot of employees that are nervous about coming back. They want to work under certain conditions. And so many state labor departments are also posting and providing information on COVID-19 labor laws. And some examples that we've been following that really do a good job, the Wisconsin Restaurant Association, and again, Dave Dedman, the past president of the Nicra organization, sent through some Dane County information. And again, this isn't specifically for you in your particular area, but it just shows you some of the examples of communications that some of these health departments and local authorities are coming out with. So Dane County, where the Chocolate Shop Ice Cream operates, have been putting out publications so far as an opening guidebooks. It also talks a bit about health tips. And so you're able to draw from that. And a lot of these links we will have on the Nicra website. This is a great graphic from the FDA in relation to just those 4 quick points of be healthy, be clean and disinfect, social distancing, and pickup and delivery guidelines. So again, this is available on the Nicra website in the COVID-19 tab. And speaking to Rich and Heather Draper from the Ice Cream Club in Florida, shared with us, their state's standards and guidelines for hospitality reopening. So definitely would check with your local state and county so far as the recommendations and what they imply, because a lot of sometimes the federal information and something that we're hearing online and in other forums doesn't always apply. Secondly, check with your staff and particularly your parents. And I think we need to be sensitive to both employee and their parents, particularly those who are employing high school kids. Having communication with parents and employees is the key. So far as what's your food safety plan? And it's interesting that, on this call and a lot of the calls that we've been having at the Nicra office, we've been talking about customer safety, but Sam brought it up quite well, and as did some of the points so far as, we really need to make sure that our employees feel safe as well. So communicating to parents and perhaps their employees, or the other way around, employees and parents, about what your safety plan is, and just keep that information flow going. Again, a lot of people are really spooked by a lot of things that they're seeing online and in the media. And so having a good employment plan that deals with some of the issues and concerns for employees and their parents is pretty important. Now, we have had some calls in the office about employees that are reluctant to return. And obviously, we're not coming down, or a lot of stores aren't coming down with a hammer so far as that is concerned. Although the Occupational Health and Safety Administration do have a section there on right to refuse to come to work. And there are basically 4 elements of that. If someone says, look, I don't want to come back to work because of these 4 points, the one thing I wanted to draw out was this number 3. And again, it's a very fluid situation, and it's a situation that we haven't really come across in a long time, is a reasonable person would agree that there is real danger of death or serious injury if they came back to work. So there are some federal guidelines to support some employees that say, look, I just don't feel comfortable coming back to work right now. Again, I would tend to lean towards your state labor department for recommendations on that. But I think many of us are very sensitive to employees' concerns and customers' concerns at this time as well. Cleaning and laying out the store. Obviously, cleaning and sanitizing all your surfaces are extremely important. I also would make sure that customers can see visually that you are cleaning between each time someone uses a register or wiping down counters and so forth. I know that in a lot of the national chains and groceries, they make people wait back, and there's a physical wipe down of that payment area before the next person comes through, which gives a lot of your customers some great peace of mind. I certainly would take the lead from national brands, restaurants, food service places, as well as grocery, as to some of the things that they are putting in place to make sure that their layout of the store works well. I know that in a lot of areas, a lot of counties and states are saying that either indoor or outdoor seating options should not be utilized. And so if you have indoor or outdoor seating, you really need to do something to prevent people from using that. And we've heard some people in Nicra just turn the tables upside down or stack them. I have seen some instances where caution tape is put all around that area. Personally, I would probably lean away from that. Anytime you're pulling up to a food place and there's caution tape in and around the entrance is not a very good look. Clear barriers is what Sam mentioned before, and Evan Walt from Ice Cream Specialties had mentioned that he had a contact for clear barriers. We're going to talk a little bit about some suppliers here that can help. And then I've seen very successful, if you can't put a clear barrier up, I've seen a lot of ice cream shops and restaurants put tables in front of that counter space just to space out the customer interaction between you as the server or your employee and the actual customer themselves. And again, markings on the floor are very good to do. These poor hospital workers, you don't realize how intense it is having to stand on the different spaces in an elevator that just must be used in hospitals. Is crazy times, but it's needed. And most certainly utilize signage just to let your customers know your cleaning schedule and how you're taking things so far as the cleaning and laying out, and their safety is extremely important. One thing I wanted to touch on here is personal protection equipment, gloves, masks, and the public perception. And in many of the forums that we're on, we see a lot of people complaining, both in public forums, Facebook and Yelp and so forth, about operators not wearing masks or not wearing gloves. And a lot of times customers do not always follow what the local food safety regulations are. So they may hear somewhere on the news or somewhere online that everyone must be wearing gloves, everyone must be wearing a mask. And yet in some counties and states, food operators don't have to wear masks. Again, this comes back down to public perception. And you can explain all you want that, well, our county doesn't require us to wear a mask. Even that conversation can be quite, hard to have. And again, I think that leaning towards the customer's perception, and again, their customer's perception is their reality, utilizing masks, utilizing gloves is a good policy to have. Now, we reached out and have been reaching out to Nicra suppliers. Obviously, we speak a lot about retailers and wholesalers, but Nicra suppliers and those who have stuck with Nicra members for many, many years are also having a pretty tough time right now. And so we've got a list underneath that COVID, or on that COVID page, listing which of our supplier members are selling gloves and masks and sanitizers and so forth. We really would encourage you to use that as the first port of call when it comes to purchasing those items. We've always suggested that Nicra members support their supplier members, and I think that's pretty important as well. You'll find all of those suppliers under the Nicra website under the COVID-19 tab. Second last point, social media and review-based marketing, so far as Yelp and other things like that. Again, communication is the key. We have found, and it's interesting when Sue and Frank and Laurie are talking about their success in their particular programs, that they've already had a robust community that follow them on social media. And so I really would say that let's start this process of communicating, particularly on your websites. Your website should have COVID-19 updates. A couple of local stores here, Clementine's, on their website has a pop-up here that they can simply click on. Customers can click on to learn more about COVID. Again, Half Pint Creamery, Nicra member, multiple locations, and there's a good explanation right here on their homepage as to which stores are open, which stores are not, what their hours are. We heard from Becky this morning, Becky at Serendipity. Again, a very good explanation right here on the front page here. Serendipity's back open for curbside, revised our menu. So please take the opportunity, if you don't have a COVID-19, or at least updating your website, particularly the homepage of your website, I think you're missing out on a valuable opportunity to connect and make your customers feel a bit more comfortable in coming and ordering from you. Obviously, social media platforms. Look, a lot of people right now are spending their time creating content. This might be a great opportunity for you to be able to take photographs and images and utilize those on your different social media platforms. We did have a webinar about a month ago with the Modern Connection, a social media company based out of Charleston, and that's available too on that COVID page. Would definitely recommend you have a look for recommendations there on connecting with your community through social media. And then finally, looking at modifying your menu. So you'll find that many states, what they have in common is that you can only do sealed containers. So we're not doing cones anymore. Sue mentioned about dome lids versus flat lids and the stackability of them. Even when it comes to stacking containers in a takeaway bag, that flat lid works very well. And obviously we're seeing here again this process of take-home packs, at-home quarantine packs and so forth. Many stores that haven't done pints are now either introducing or increasing their pint production. And again, we're seeing a lot of success with third party or your own deliveries and curbside. And I think there's something to be learned by Frank and Laurie's example of really connecting with the local community and getting that word out. I mean, I call them suburbs. What's the word I'm after, Elizabeth? Whole subdivisions. Ordering is a great way to be able to keep that, keep your brand and your products in front of your local community during this process. And again, having that updated menu posted on all of your socials is extremely important as well. So they're just some quick tips of some of the things that we've seen come through the office that we're posting on our Nicra page. Let me have a look at the chat here. It says that I've disabled the chat, but I don't think that I have all attendees. Sorry if I'd done that. So let's talk about general Q&A. We still have Sam and Sue and Frank and Laurie on the line. Anyone have any questions about or suggestions as to some of the things that they're doing to kind of help through that process? Jim says, I've heard employees not wanting to return because they are currently making more on unemployment through July. I think, how does that suggest handling if that occurs? That's a challenge. And I think that it kind of comes back to the process of, you know, the relationship you have with your employees. I know that might be one situation, where another situation is that many employees have been asking employers when can they come back and if they can come back. So there's a lot of that going on. At what temperature is the virus killed? Sam, if you're on, are you able to answer that question?
Yeah, the virus is killed. They've done studies, so general pasteurization temperatures, right? So 160, above 160 degrees Fahrenheit, inactivate the virus, right? When you're following the appropriate time and temperature for pasteurization. So like cooking and things like that should inactivate the virus.
Okay. Very good. I haven't heard too much about using Uber Eats, DoorDash, Postmates during this time for pint delivery. Is that not a preference versus taking order yourself? In my experience and through the office here, I think that there's a balance of some stores using Uber Eats and so forth. I will tell you that I know that Uber Eats offered a link where we had a webinar with Uber Eats that they reduced, or and I'm not sure if that's still in place, but many of those third-party deliveries are also offering limited or reduced rates when it comes to utilizing their products as well. And we have had Nicra members that that continue to use third-party delivery and just utilize the cost of that, sometimes up to 30% of that price or the purchase price. They utilize that just as the cost of doing business. That's there. We have some hands raised, so let me, Cami, you might have a hand raised from earlier. Cami from Carpajani. I think you are muted, Cami, right now. Hand down. Okay. Downside is that you got hands up here, but I don't know whose hands were up from earlier before. Any more advice about queuing outside the store? Any way to entertain the customers? From Fabrizio. That's a great point. I know that, and again, with many conversations with current operators and local authorities, you can only do so much in order to keep people social distancing. I know some of the food service places around here in St. Louis have someone out the front that actually is telling people to move apart. And I think, again, in the spirit of ice cream versus the spirit of making sure that the customers are safe, it's important to make sure, I think the minimum standard is to put those markings on the floor. And I think, again, this is the one thing right now that unites the whole country and unites the world, or something that we have in common that we're all dealing with. For the most part, people are quite respectful in that queuing and social distancing. Lisa says, I plan to use Square online with allowing the option to use a pickup time. Do you know how this appears on the order screen? And does it line up orders by pickup time? Sue, are you able to answer that question? You use, I'm pretty sure you're using the Square system.
We use Square. However, I have not allowed a pickup time. It's just been a 2-hour time window that we give our customers. So I'm sure if you posted that in the Nicra Facebook page, you would get responses.
Yeah, that's a good response. Question, Sam, are employers legally liable if an employee gets the virus?
That's my I am not a lawyer statement.
Right.
And I think there's a lot of questions around that. I think we just saw, right, that at least for the meat packing, the meat processors, right, that executive order, there was a portion around there about limiting the liability of the company. But I don't know that that applies for all food manufacturers. So that's something I would watch out for.
Yeah, I think too, reasonability comes into play. I think if you're doing everything that you can to reasonably provide a safe workplace for your employees, and that, and we've spoken about them before, providing PPE, having spaced areas, perhaps putting barriers between workplaces. Again, this isn't the place for legal advice, and I'd probably direct you towards your attorney for that. But I think it's very evident in a lot of places, those businesses that are actually going above and beyond to try and provide a safe workspace for their customers and their employees. And
I would just add on top of that, Steve, is that, that due diligence that you're mentioning there is critically important. And as a food safety plan guy, right, documentation is key, and verification. So showing that you've trained your employees then on the new practices, have record keeping showing that you've trained them, right? You've recorded that down. And then if you're using social distancing and things like that, think about having a system where you at least visually check and record, right, that, hey, we're using social distancing and I visually check that my employees are maintaining, right, those distances. Or if you're like, doing screening, that you have that documentation showing that you're recording their temperatures or asking them about their symptoms, so that if someone comes back, you can say, hey, this is the paperwork that shows that we were doing, right, everything that we needed, that we could reasonably be doing to protect our employees.
Right.
So.
And while I've got you, Sam, do you still recommend closed containers after the shelter in place has lifted? Personally, I think that a lot of states and counties are going to, and they've mentioned it federally, as phase 1, phase 2, phase 3. And I still think, even though the shelter in place, when it's lifted in a lot of states and counties, that people are still going to be very wary about, food service and making sure that all of these things are put in place. Personally, I think that I would still continue to do covered containers, just for peace of mind of customers. What are you thinking about that, Sam?
Yeah, I would agree that I would continue. Just because we reopen, it does not mean that the COVID-19 is gone, right? It's still here and has a potential to come roaring back if we're not careful. So I would continue following these best practices. I think we're going to see that there are going to be a lot of changes in practices that become our new standards moving forward because of this. So,
right. We did mention that we have vendors that have those supplies in stock. Again, they'll be on the COVID-19 page of the Nicra website. So we mentioned that previously. Jim says he's thinking of numbering parking spaces and going to the cars and taking orders and delivering the cars when ready. That's a good idea. Again, I think Sue's idea of just basically funneling them in so you have somewhat control over that is a great idea. Look, we've come to the end of our time. A lot of great questions and answers here. I don't have anything in the pipeline so far as Q&A is concerned. I do want to thank our panelists. Sam, we appreciate your time, as well as Sue and Frank and Laurie. From a resource standpoint, obviously, we want to make sure that we're getting the most credible information to all of our members. So Nicra.org, we have a COVID-19 tab there that we're updating daily, and we're trying to cycle off some of the information that may be earlier in the process so that it's fresh for you. Sam's website is the Institute for Food Safety.cornell.edu. Again, a great partner with the Nicra organization in providing food safety training both online and at our national conventions, which is great. That's about all we have, folks. If you have any other questions, please feel free to reach out to the office. We are more than happy to help direct you in the right way if we can't answer your questions ourselves. Please stay safe, and we'll talk to you very soon.